Tonight on this edition of Healthcare Update, we're going to take a privileged glimpse of a top neuropathy doctor and his pioneering methods to ease the pain and agony of patients suffering from peripheral neuropathy. I'm your host Laurie de la Hosse. And our story starts in Pittsburgh, Pennsylvania, so stay tuned while we discuss treatment reviews of neuropathy and the best and most effective neuropathy treatment options. In this healthcast I will help you answer your questions about peripheral neuropathy like: what's neuropathy pain? How do you treat neuropathy and neuropathic numbness and pain in the feet or hands? Will neuropathy pain go away? Is there a neuropathy cure? What is the best neuropathy treatment option? Are there any neuropathy treatment options without drugs? What is neuropathy natural treatment? What neuropathy treatment equipment is available to provide pain relief for my feet and hands? I'll also help you answer the question: how do I find a peripheral neuropathy treatment center near me? Our neuropathy treatment review may challenge everything you have been told about peripheral neuropathy and its treatment. Laser and laser acupuncture are major breakthroughs in neuropathy treatment. Laser is a novel approach which not only reduces neuropathic pain, but may actually help to repair and regenerate damaged nerves. Laser has truly changed the rules of neuropathy treatment. Researchers publishing the medical journal, Bioengineering, reviewed 26 studies of the effects of laser on nerve regeneration and repair. Taken together, the results of these studies led the researchers to conclude that laser therapy is able to accelerate the process of nerve regeneration. They found that laser therapy has the ability to increase both the actual number and the quality of myelinated nerve fibers. They also reported increase in nerve function with decreased pain and inflammation. Also remarkable was their finding that laser therapy actually increased the release of a hormone known as nerve growth factor. This increase in nerve growth factor is likely responsible for the observed neural regeneration. This makes laser and laser acupuncture the closest thing to a neuropathy cure currently available to patients suffering from peripheral neuropathy. Ultrasound. Similar to laser therapy, therapeutic ultrasound is one of the few available neuropathy treatments with scientific evidence to suggest it can not only relieve neuropathic pain, but may also enhance the regeneration and repair of damaged nerve fibers. In a study published in the medical journal, Scientific Report, researchers found that the application of ultrasound improved the speed of nerve conduction, which is a measure of nerve function. The researchers also reported increased nerve regeneration and thicker myelin, which is an indication of nerve regeneration and repair in response to therapeutic ultrasound. So it would appear, based on available scientific evidence, that the inclusion of laser and ultrasound therapy in the treatment of peripheral neuropathy may not only reduce symptoms of pain and numbness, but may actually promote nerve repair. No other currently available neuropathy treatment comes close to the benefits produced by ultrasound and laser therapy. The combination of ultrasound with laser therapy adds a whole new dimension to natural treatment of peripheral neuropathy by attempting to repair damaged nerves rather than just mask the symptoms of nerve damage. Thermal grill. To understand what is neuropathy pain and how the thermal grill helps relieve it, we need to take a quick look at a nerve under a microscope. Why some people have painful neuropathy while other people experience more numbness than pain is related to the type of fiber damaged in their neuropathy. Small nerve fibers, highlighted in red, are associated with painful neuropathy. The thermal grill device preferentially treats the small nerve fibers associated with painful neuropathy. It is one of the best treatment options available for painful neuropathy. Treatments that fail to address small fiber nerve damage often lead patients to wonder if their neuropathic pain will ever go away. No other neuropathy treatment equipment is more uniquely suited than the thermal grill for addressing small fiber nerve damage. The thermal grill device stimulates small nerve fibers that are associated with cool and warm sensation simultaneously. The device is held over points where the nerves exit the spine and also points where the nerves branch in the periphery. Thermal grill is held over the nerves just below the knee, at the ankle and toes for painful neuropathy of the feet. It is held over the elbow, the wrist and fingers for pain in the hands. The thermal grill can be an excellent neuropathy treatment without drugs. Electrical stimulation. Many patients experience numbness as their primary symptom of neuropathy. Research suggests that damage to the larger fibers, seen highlighted in blue, is associated with numbness rather than pain. The most effective treatment of numbness, electrical stimulation, is known to preferentially activate large diameter nerve fibers. When a patient's predominant neuropathy symptom is numbness, targeted electrical stimulation of the large diameter nerve fibers typically gets the job done for these patients. As you can see, matching the appropriate combinations of treatments to each individual patient's neuropathy signs and symptoms offers relief in a class by itself. Ion channels. Most commonly used neuropathy medications either directly or indirectly affect ion channels. Ion channels act like switches in nerve endings that affect the sensitivity of the nerve. In neuropathy, ion channels are typically wide open. This is believed to result in the hypersensitivity experienced in the hands and feet of patients suffering from neuropathy. There are a number of natural neuropathy treatments that scientific studies have shown are able to block these open ion channels. These substances reduce the sensitivity of the nerve. This can help relieve both pain and numbness in neuropathy. These natural ion channel blockers can be used both topically and taken internally to reduce the sensitivity of the nerves in neuropathy. Neuromodulation. Neuromodulation can be employed as a futuristic treatment in cases of extreme neuropathy. Neuromodulation is an innovative neuropathy treatment that entails using state-of-the-art technology to block pain signals from the feet or the hands and preventing them from ever reaching the brain, through targeted electrical stimulation. Until recently, neuromodulation techniques required surgery. Recent advances in the latest technology of neuromodulation now make it possible to block pain signals from reaching the brain without surgery. These techniques offer hope and help for even the most advanced cases of neuropathy. When it comes to finding the best, most effective neuropathy treatments, there is simply no substitute for a knowledgeable and experienced doctor. Meet Dr. George Kukarin, chiropractic neurologist and our featured neuropathy pain relief specialist near Pittsburgh. Dr. Kukarin has published cases from his office in peer-reviewed medical journals indexed in the National Library of Medicine. He also provides peer review services to ensure the quality of medical research for the journal, Neuromodulation, Technology at the Neural Interface. He pioneered techniques in the non-invasive treatment of peripheral neuropathy, and the results of his work have been presented at medical conferences at Johns Hopkins here in the United States, and international medical conferences in Europe and in Australia. He has conducted collaborative research with the University of Wisconsin at Madison, and was a keynote speaker at the International Symposium on Clinical Neuroscience in Orlando, Florida. Most importantly, Dr. Kukarin has published a textbook detailing the science behind the diagnosis and management of peripheral neuropathy. Every neuropathy patient has their story, and with neuropathy, sadly, it is usually a story of loss and longing. Something that you like to do, but because of neuropathy, you no longer can do it. Does this sound like you? What would you say if I told you that there was hope and a way to make your neuropathy story have a happier ending? To show you what we mean, let's visit with some of Dr. Kukarin's neuropathy patients. Meet Gene. Gene's neuropathy story was a simple one. He simply wanted to be able to wear shoes like any normal person. But his neuropathy was getting worse, not better. So wearing regular shoes was all but impossible for Gene. That was until he decided to consult with Dr. Kukarin. Here is Gene in his own words.
It started out as just numbness in my feet, and then it started going up my leg towards my knees, and then I started getting burning in my toes that I couldn't wear socks or shoes. And that's when it was really getting bad. Well, I went to a neurologist and she told me that there was really nothing they could do but just increase my neuropathy, my medication for the neuropathy, Neurontin. And they kept increasing that, and I was getting tired of taking pills. And I was at CVS and I picked up a magazine, Healthy Living, and I saw Dr. K's ad about neurology and came here, and that's when I started. I've been dealing with the neuropathy for about, I'd have to say, almost 10 years. And it's been progressively getting worse, and now I'm able to wear sneakers. I was down to just wearing Crocs and flip-flops, but now I don't have to put the lidocaine ointment on my toes. The toes don't burn, and I can even wear cowboy boots.
Next, meet Cheryl. Cheryl developed peripheral neuropathy as a result of medication she was taking for her arthritis. Cheryl's neuropathy story is more fundamental. She was desperate to get a good night's sleep. We really don't know why, but the pain of neuropathy seems to be much worse at night. This often interferes with the ability to get a good night's sleep. This can radically reduce a person's quality of life, not only keeping a patient up all night in pain, but also rendering them tired and non-functional the next day. Listen to Cheryl as she describes the right way to lessen neuropathy pain and how she is now able to enjoy a good night's sleep again.
I've had neuropathy probably for the last 5-6 years. It got progressively worse. At first I was just getting night cramps, like maybe 1 or 2 times a night. And then I would say after, or recently, like maybe a year ago, before I started to see Dr. Cochran, I was probably every hour to an hour and a half up at night. And if you've ever had neuropathy, you know you can't just lay there in bed. You have to get up and move around. So I was feeling just tired all the time. And the second doctor put me on gabapentin. Now, I don't know how it strikes others, but to me it made me very dizzy and it made me spacey. And I still work part-time and enjoy working part-time, and it just interfered with that. And so I went back to a second primary doctor who also said I hadn't been on gabapentin long enough. So let's go another 4 months on gabapentin. Because with the leg cramps and also the cramps in my feet, someone suggested that I go to a podiatrist. So I went to 2 podiatrists. I have spent $800 in orthotics, and they recommended that I go through surgery. So I put up with dizziness. I was still getting the cramps at night. And then I read an article by Dr. Cochran, and I don't even know what magazine I read it from, but I thought, this is exactly what I'm feeling. This is exactly what I'm feeling. So I made an appointment and I came in, and then when they talked about some of what they would do for me, I just thought, oh, it's probably just another doctor, and I've now dealt with this for 5 years, but let's give it a try. I think skeptical would be definitely the word. Well, I think someone has to be ready. They have to be desperate, and they have to say, I need help, and I'm willing to try anything. Yes.
Is there anything, Cheryl, that I've missed that you would like to add about your neuropathy, about your treatment here, about Dr. Cochran? Did I miss anything?
I don't think so. At first, I was very hesitant to reduce the amount of methotrexate I was taking. And now, like I said, I'm completely off of it, and I feel so much better. So I actually went from 6 2.5 milligram pills of methotrexate, and now I'm off of it completely. and I am happy to say I have no leg cramps at night. Now, it's taken probably 6 months, but let me tell you, it's been worth it. I finally, and like I said, I was desperate. So I finally feel so much relief, and so I'm very grateful. Oh, my life has changed dramatically, and I think it's because I can get a good night's sleep.
Becky's story is all too common amongst patients suffering from peripheral neuropathy. She suffers from inflammatory, autoimmune neuropathy. It's one of years of suffering, bad advice from the wrong doctors, and dwindling hope for a better quality of life. But Becky's story, thankfully, shows what is possible with the right treatment from the right doctor. The improvement in her neuropathy symptoms is quite literally what she had always dreamed about. Here's what she has to say now.
I've had it for approximately 10 years or more. Well, I've been to a lot of places. They even took biopsies of nerve, and they told me that my body is shredding the coating on my nerves, and that there's not anything they can do to help me. And I can step on things. I get cactus needles in my feet and wouldn't even know it. I went to my boss, told her I couldn't do it anymore because I couldn't lift my feet to get in my bed. I'd have to fall on my bed. In the beginning, when I first turned numb, I had the numbness and the pain. And I had to take medication. And every so often I would develop an allergy and I'd have to change medications. But the pain was so bad I couldn't walk. When the first doctor couldn't help me, and they could only give you 3 different kinds of pain pills before you had to go to pain management. So I was sent to pain management, and they got me hooked on morphine and methadone. Well, I decided that I would have to live with the pain like the doctors told me, but I did not want to take medication like that, addictive medication, and they kept increasing it all the time. It was really difficult for me, all these years of having to put up with this when there is something that can be done. And the other doctors wouldn't help. But Dr. Cooper, he's helping me. Well, the pain it's less, and I'm getting a little more feeling in my feet. My daughter dropped a can on my big toe, and it didn't hurt when it happened, but that was yesterday, but today it hurts. And that's rare to have any feeling there. I tell him to go see him because he can help. He's an excellent doctor. He's helped me.
Diana's story is literally one of life and death. She was battling breast cancer and she experienced a very common side effect of chemotherapy, painful peripheral neuropathy. Chemotherapy-induced peripheral neuropathy can be so severe that it forces the oncologist to terminate the cancer treatment. When you're battling this serious disease, the pain of neuropathy is the last thing you want to deal with. You need to reserve all your strength and energy in the struggle to save your life. Diana's story demonstrates what is possible with the neuromodulation techniques we discussed earlier. Listen to her story.
Okay, My name is Diana Bickle, and I am happy to give my statement for Dr. Kukaran to use.
Great, thank you so much.
What brought me in to see him was that I was experiencing a lot of pain in my hands and feet from neuropathy. I have stage 4 breast cancer. I've had 2 rounds of chemo, and about 3 months after my second round of chemo ended, I started getting sort of the numbness and the tingling, which, was okay. But about 6 weeks before I came to his office, the pain got excruciating. It was running up my hands to my elbows. I tried ibuprofen, aspirin. I'm on morphine for other types of pain. Vicodin. I went to the higher level stuff. Nothing helped me, and I wasn't able to sleep at night. And talking to my my oncologist and my doctor my spinal doctor, they wanted to refer me to a neurologist, which was fine, but I couldn't get in to see the neurologist for like another 4 or 5 weeks, and no one had any answer for my pain except perhaps to take some of the new drugs that are out there. And I didn't really want to do that. I've had so many side effects from so much other medication. I didn't really think more medication. And really, they told me the only thing it was going to do was mask the pain and not really get rid of it. My oncologist literally said, well, you'll still have it, but you won't care. I had seen Dr. Kukaran before I had cancer. In fact, he's the one who, in the first place, helped me diagnose my cancer. 6 months with other doctors. He literally saved my life. So I decided to come back here, and I told him about my neuropathy. And he right away had a couple of things that we could try. So he wanted to have my information. He studied it for a week, and when I came back to see him again, we decided on a treatment for me. It basically turned out to be a very simple process. It's a matter of putting some electrodes on your forehead. And of course, I'm sure there's some very detailed stuff that goes on behind the scenes, but from my perspective, that's pretty much what it was. Laying down and having this treatment for 10 minutes, which basically felt like someone tickling your hair. The next day, I got up and there was no pain. I literally had no pain, no numbness, no tingling. It was such a huge relief. You have no idea. I was so excited. And so the initial treatment is 5 sessions of 10 minutes, 5 days in a row, which I went ahead and did. And after that, you do follow-up treatments every week or so. And I did that, and since then, I've had no pain. I haven't had a treatment now in almost a month, and I still am experiencing no pain or numbness in my feet or hands, and it's wonderful.
Hello there, I'm Dr. George Cook-Rin. I hope you enjoyed my video. If you are like most people, you probably had no idea that there are alternatives to conventional treatments for serious neurological conditions. I'm here to tell you, you don't have to live with it, but don't take my word for it. Subscribe to my YouTube channel. You'll see examples of what is possible with the work we do. Check it out, because seeing is believing. If you're seriously interested in finding help with your neurological condition, you owe it to yourself to visit our web pages and find out more about what we have to offer.